Hello, everyone. I'm Selena Gore, the CEO of WomenHeart. And for those of you who don't know, we are the first and only patient-centered organization in the US dedicated solely to supporting, educating, and advocating for women with and at risk of heart disease. Today, I'm so excited to welcome you to this special live interview as part of our Her Heart, Her History campaign, which honors both Black History Month and Heart Month. This campaign is really meant to highlight heart disease among Black women, and it also celebrates the courage that Black women have shown who have made significant contributions to improving the health of women living with heart disease. And through the stories that are being shared by our champions, we hope to empower others to take control of their own heart health. Today, I have the absolute pleasure of welcoming WomenHeart Champion Charity Watkins from North Carolina. Hi, Charity.
Hey, Selena. It's so good to see you.
As always, it's wonderful to see you. Before we delve into your heart story, Charity, can you just introduce yourself and tell us a little bit more about your life in North Carolina?
Sure. So I'm originally from upstate New York, Rochester, but I moved to North Carolina when I was 18 to attend UNC Chapel Hill. So go Tar Heels. I completed my bachelor's in sociology, and then I took some time off, came back to finish my MSW at UNC Chapel Hill School of Social Work, and then transitioned to the PhD program and completed my dissertation defended in 2019. And so now I'm here with my family, with my husband, Richard Watkins, Dr. Richard Watkins, and my 8-year-old daughter, Margot.
Now, Charity and I have a special connection because Charity went to our Training for Champions, our Science and Leadership Symposium in 2019. So when you said 2019, I'm putting it together, Charity, that you finished your dissertation and you went to SNL the same year.
Yeah.
It was amazing.
Well, I will tell you that year was jam-packed. So I defended my dissertation in April. I was already an assistant professor at North Carolina Central University in the Department of Social Work. And then came to Rochester, the other one in Minnesota,
right?
in order to participate and become a WomenHeart Champion. And unfortunately, that year ended with me losing my mom to cardiovascular disease.
Yeah.
So it was a year of highs and lows.
Yeah, I can only imagine. Yeah. So let's back up. And let's get you to talk a little bit about your experience with heart disease. So how that kind of came into be in your life, and then what has transpired since your diagnosis.
Sure. So I was diagnosed with peripartum cardiomyopathy, or pregnancy-related heart failure, about 8 years ago. Actually, it'll be 8 years next month. Or the month after, I should say. And I was diagnosed after experiencing several weeks of very concerning symptoms. I had shortness of breath. I was very fatigued. I couldn't lay flat on a pillow. I also had a nagging cough, and I communicated with my OB since I was in the postpartum period about my symptoms. And at first I was told that maybe it was symptoms of the flu. When I went back again, I was told maybe I was experiencing symptoms of postpartum depression. I followed through on all of those potential causes for my symptoms, but it wasn't until I went to the ER, had to leave after waiting 5.5 hours, and was finally seen about a couple days later at Campus Health, where I was finally told that my heart was enlarged, and then I call it a physical referral back down to the UNC hospital. And I was there seen in the emergency room, finally, after several hours again of waiting, and was diagnosed then. And I was told that my heart was functioning at around 5 to 10%. And I was very close to not being here anymore. And so I stayed in the hospital after having my baby, I was really amped about being able to breastfeed, being able to spend time with my newborn. We were first time parents and 2 weeks away from my family, and going through a very scary time of realizing that at the age of 30, I had heart disease.
Wow, it is blowing my mind just to think about the numerous opportunities that the healthcare system had to make a diagnosis, and that there were so many delays. Cherry, how do you hope that sharing your journey of being diagnosed with postpartum cardiomyopathy, and then overcoming it can inspire, perhaps, and empower, more importantly, I think, other Black women facing similar challenges in pregnancy and postpartum?
Yeah, so sure. I actually hope that just my presence in many of these spaces where patients often aren't at the table is providing providers as well as administrators, researchers, scientists overall with some sense of who needs to be brought to the table. So
Yeah.
I am one patient, but I am one of many women, including Black women, who have experienced cardiovascular disease. I ask hard questions, and I do this across a range of realms that I enter as a researcher now. But I ask hard questions like, why aren't there more patients involved in this? If we're going to engage patients, please let's not ask them to do it for free. Let's compensate them. Let's see their experience as expertise. And so, what I have learned over the last few years is that by me sharing my story, other folks are empowered to share theirs as well. We are turning trauma into triumph,
Mm.
and we are finding ways to heal through telling our stories and empowering our healthcare systems to do better.
That is such a powerful statement. Can you say that again? I'm like,
We are transforming trauma into triumph.
that is, whoa, I'm blown away. I'm blown away by that. And I think it's worth pointing out for the audience that when we talk about Black maternal mortality in this country,
Mhm.
which is embarrassingly the highest, right, of
Right.
any group, the leading cause of death for Black mothers is heart disease.
Yes.
So I think it's a moment, it's worth pausing, because we it's important, and I think that the attention that Black maternal mortality is getting is absolutely warranted. It is
Yes.
it is a crisis in this country, but I feel like the next sentence below that headline should be, and the number one cause of death is heart disease. uh,
Yes.
and you use the phrase like, you may not be here today had you not gotten that diagnosis. you know these statistics matter.
Yes.
And so one thing I want to ask you is, how do you think healthcare providers, be it doctors in the ER and otherwise, how do you think they can work to enhance early detection, diagnosis, and treatment of PPCM, or postpartum cardiomyopathy, and in particular among Black women?
Yeah. So what I have learned, and I failed to talk about where I am now in terms of being a social work researcher focused on severe maternal morbidity. I have learned a great deal from my experience at Duke University as a Birch Scholar, where I study this very phenomenon that affected me. What has become apparent to me is that many folks don't actually even know about the racial disparities and inequities that even exist. They don't know that Black women are uh, 3 times likely to lose their lives before, during, or after childbirth. They don't realize that many of the symptoms that we are experiencing are actually telltale symptoms of heart disease, but because we're not being listened to, because we may be deemed as difficult patients, because there may be more a desire to identify individual factors like you need to eat better, you need to exercise, that is actually the experience of racism that is contributing to our high rates. And that's why cardiovascular disease, even beyond pregnancy, is the number one underlying cause of death for Black individuals. And for Black women who are pregnant, this is a very vulnerable time during our lives. This is when that any underlying issues that we may not have even known before may pop up. And I was lucky enough to be categorized under maternal morbidity, but it could have very much been likely that I was a case of maternal mortality. What we need providers to do is listen. I know that there's the Hear Her campaign that actually illustrates the importance and actually provides tools to providers on how to listen to patients so that we can get that early identification of cardiovascular disease. We also need to really have some deep introspection about our racial bias. Do we automatically assume that because someone is coming in and they have maybe done something to contribute to the issue? Are we automatically considering them as maybe going overboard or exaggerating their symptoms? It's not that bad. Or are we even considering, oh, well, because you're of this background, most likely you're able to take on and experience more pain than other groups? These are what we have found to be evidence of racial bias within healthcare in general, but also it shows up in maternal healthcare. It shows up in when you're going into your prenatal visits. It shows up when you are talking with your provider and you are trying your best to advocate for yourself. Like, we've done a lot of work around patient literacy, but what we really do need to think about is provider literacy. Are you actually skilled to hear what your patients are saying? Are you receiving training and communication with patients? Are you actually delving into what is the current research and what are the current findings that may affect the patients that are coming to you and sitting in your clinical room? And so I think there's a lot of work for everyone to do. It is not just on providers, it is on healthcare systems. As a social worker, I value and really hone in on the issues of structural racism. These are things that we all need to partner in order to address and eventually eliminate.
So along those lines, Charity, can you talk about your particular approach to advocating for improved access to healthcare and quality healthcare, right? Resources and support for heart health within your community, but I would say within communities in general across the country?
Sure. So again, going back to my social work background, I'm a social worker through and through, and I believe my mom named me Charity for a reason, whether it's manifest destiny or it was just overall meant to be. I live that every day. I live with the idea and the perspective that my voice matters. And so I have over time become more comfortable with entering these spaces where I may be the only Black person. I may be the only Black woman. I may be the only patient. And at times I am the only social scientist. And this was within research spaces. I come in with that experience of saying, I am not just representing myself here, but I'm representing the voices of many folks who need to be brought to the table after me. I am just an entry point. I am not the end point. And so this is me really encouraging you all to reach out to folks like me. It's not just going to be where we need to rely on patients coming back to providers and asking them, what can I do to help? That is unfair. There's a power imbalance within that. But what we do need to realize is that we have a responsibility to reach out to communities, to learn about communities, learn what are the stressors, learn what are the social determinants of health that may be impacting their ability to access quality health care. We need to have these collaborative communications and collaborative groups where we are able to partner with communities versus telling communities what they need to do.
Absolutely. So I know a little something about you, Charity, that you are a patient representative on a PPCM research project.
I am. Rebirth. Yes.
Earth, which is amazing. I know that the NIH, the NHLBI, the National Heart, Lung, and Blood Institute, who is funding that project, was very keen and was very specific about bringing on a WomenHeart Champion to participate and play this role. And I know I've seen it, that you have played a vital role in improving the experience for the patients and those who are participating in the research. So reflecting a bit on that, reflecting on your journey with PPCM, what lessons or insights have you shared either within the context of that research study or otherwise that you think might be helpful for others who either are going into their pregnancy or maybe postpartum and are, thinking, I wonder if these symptoms are that experience, that experience of PPCM?
Yeah, so as a member of the patient engagement committee, I actually have done a lot of work with using my intersection of being a social worker practitioner and a social work researcher to, in a way, translate sometimes the language that is used to explain what's going on around cardiovascular disease. I help with kind of fine tuning language or saying, hey, someone who is not a researcher or a clinician may not know what that means. Yeah. We may need to break it down a little bit more. Or, hey, if we want them to take this survey, we cannot have it where it takes 20 minutes to complete. We're talking about patients who are not only dealing with potentially a new chronic condition, but they're also parents. They also probably have jobs. They also may have partners. So we have to consider that these are whole people, not just, research subjects. And so I really try to focus on humanizing research and also, in a way, trying to work around power imbalances when it comes to understanding cardiovascular disease. Patients have experience, providers have expertise, but we are both coming to the table with expertise that is valuable and will need to be tapped into in order for us to make a change.
And I think the audience can see why I was so excited to have this conversation today with Charity. I mean, WomenHeart, I think as an organization, one of our biggest roles is this translation function.
Yeah.
That there is a real gap between how clinicians and the healthcare system in general speaks about different aspects of women's heart health and how patients and individuals like/need to receive that care, that information and that awareness in order to take the appropriate actions to improve their heart health. Right. There seems to be that gap. And I think you described so eloquently, Charity, that function, the fundamental and critical function that you played in the context of this research study, which is vital to making sure that we are collecting insights on how to improve the experience of women and pregnant individuals or postpartum individuals who are, facing some of these issues. What would you say is one wish that you would like to leave for any woman who has traveled a similar road to you?
Oh, I want the road to be easier and shorter. I want for another woman who may find herself where I was with receiving this life-changing diagnosis to have a team ready to support her, ready to provide her with insights into what's going on, to kind of help reduce the scariness that comes along with being told that you have heart failure.
Yeah.
I wasn't, my mom had heart failure, my dad had heart failure, but I saw them as literally every day to day. It wasn't something that affected their lives, but to hear me at the age of 30 with a newborn being told that I have heart failure, that I can no longer have any more children, that I can no longer breastfeed because of my medications, that I'm going to be taking medications overall for the rest of my life. Those are devastating pieces of news that I just wish I had a greater support, formal support to reach out to in order to deal with it, in order to not be left on my own trying to figure out how to move forward.
Yeah. Yeah.
Yeah.
And how do you feel today?
Oh, well, I am active. I am all over the place. I am, as I shared before, a researcher. And so I am presenting at conferences. I am conducting my own research at the university. I am also proud to say that I am the board chair for Equity Before Birth, a nonprofit organization based here in Durham, North Carolina, that fuses social justice with birth justice and really works to fill in the gaps that are left by some of our social safety net. We know that the net is wide. There's a lot of different holes in it. So Equity Before Birth, for instance, is one of those organizations that is working to do the hard work of supporting people who may have experienced something I did, or other forms of maternal morbidity, or just recovering from birth. I think we don't always take into account how much of a difference you are, like how much you change from before birth and after birth. You are a totally different person. You have different roles that you have to fill now. You are no longer just you responsible for you. You are responsible for this little being who depends on you. And you also potentially may be dealing with this chronic condition that you didn't see coming. And so I think for me, some of the most rewarding work has been with community members. I'm learning so much from them. I'm learning about, hey, there's some places that I have blinders and I need to learn more. And so that's one thing that I'm trying to model for the providers that I meet with. If I'm a lifetime learner, I want you to be one as well. It doesn't stop at just med school. It doesn't stop at just your CMEs. It continues on. It moves forward, and that's what's going to allow for us to actually eradicate racial disparities in maternal health care and in cardiovascular disease.
Charity, thank you for joining us today. This has been an amazing conversation. Thank you for being an incredible example of thrivership, which is my favorite word at WomenHeart.
Yes.
Thank you for your dedication to raising awareness and educating women in your community, and indeed in communities around the country. And to everyone that has participated in this conversation, I would urge you to please stay tuned to our social media channels and to look out for more content this month. I know this month is fast coming to a close, but we do have more stories about champions like Charity throughout the month. Visit our website at womenheart.org/herheart to learn more about this specific campaign, to access additional information and resources, to share it with others, to share it with the women in your life. And I just urge you to celebrate Charity with me and to celebrate the thrivership that she, epitomizes and is such a role model for not just WomenHeart, but for women across the country. So thank you, Charity, so much.
Selena, thank you for your leadership. Couldn't do it without you. Thank you.
Thank you. Thanks, everyone.